Alternative of ventilator machine for COVID-19 patients. Hi, I am AGM Rubal Hassan, lecturer, Physics, Balarampur Darsha College, Atwari, Panchgarh. A small attempt on my part. I designed a small machine that can use as a ventilator. This is a prototype. The cost of the machine is making approximately 8,500 taka. Nowadays COVID-19 is a burning question of the world. This novel coronavirus infects millions of people of the world. More than 185,000 people died worldwide by this virus. Most of them died as due to respiratory failure following pneumonia after COVID-19 infection. During respiratory distress, doctors support the patient with oxygen along with other medication. By this cheapest machine we can give the patient up to 100% oxygen through face mask or ET tube, endotracheal tube, that can save lives. The operating system of this machine is too easy to use by every healthcare professionals, doctors and nurses. Most of the upazila health complexes and district hospitals have few ventilators. So, it can easily use in those hospitals, even in medical college hospitals where ventilator are not available. In present situation available supply of this machine is possible in hospitals after clinical trial to save life of critically ill COVID-19 patients if the health authority wants. May Almighty saves us.